Hi, I'm Stacy Wilson. I'm an advanced practice provider with the heart surgeons at the Marcus Heart Valve Center. Our goal with this video is to help you understand what to expect as you're preparing for your upcoming surgery at Piedmont Atlanta Hospital. As your heart team, we look forward to helping guide you every step of the way. Our first step is to bring you into our clinic. Our schedulers will contact you, and if there's time, we'll send you a bunch of paperwork to fill out before you come to the office. But don't worry, if there's not time, we have plenty of copies waiting for you when you arrive. On your appointment day, you'll first meet with an advanced practice provider like myself. We'll review your medical history as well as your symptoms. The surgeon will sit down and review all of your imaging, labs, and exams, and then he'll come in, and as a team, we'll come up with the appropriate surgery for you. Once your surgical plan is in place, you'll meet with our schedulers to set up times for signing the consent, pre-op testing, and of course your surgery date. And we promise we'll give you a map of the hospital so you can find your way around and find your way out. Based on your health history and your diagnosis, you may require additional testing prior to your surgery. Some of these exams can be done closer to your home, but regardless, within 2 weeks of the surgery, you'll have to come to Piedmont Atlanta Hospital for your pre-op testing day. This includes labs, EKG, chest x-ray, and meeting with a member of our heart team. There, they'll review all the instructions for the night before surgery, give you the cleanser to prepare your skin for surgery, and give you an incentive spirometer. This is a breathing machine that will help re-expand your lungs after surgery. The whole appointment should last approximately 2 to 3 hours. The morning of your surgery, you'll check in admissions in the main waiting room at Piedmont Atlanta Hospital. You will be brought into the pre-op area, and your family members will be escorted into the waiting room and meet one of our wonderful Piedmont Atlanta patient representatives. These representatives stay in touch with the operating room all day long and keep your family up to date on your status as you move through the different stages of your surgery. Once you're brought into pre-op, you'll meet with the anesthesia team, have IVs inserted, and you'll be placed on a heart monitor. Once they have everything ready for you, we'll go ahead and take you right back into the operating room. The amount of time you'll spend in the operating room and the length of the surgery will be discussed with you during your preoperative appointment. But when your surgery is complete, you'll be transitioned directly into one of our intensive care units. And again, that's when the surgeon will go out and meet with your family and discuss the surgery. After surgery, you'll be transferred into the intensive care unit. You'll remain asleep there for a few hours, and as they start waking you up, we have to know you can breathe on your own, then we'll remove the airway. You'll remain in the ICU as you come off of a lot of the medications that we used in the operating room and your pain gets controlled. Then you'll be able to transfer to 3 South, our post-op floor. Please know we really appreciate family members coming in to visit in the ICU, but unfortunately we can't let them sleep there. As your healing continues, you'll be transferred up to 3 South, which is our post-op recovery unit. You'll work very closely with our amazing staff of nurses, physical therapists, and other professionals as you recover from your surgery. More details into exactly what will happen will be described in your heart surgery booklet that you'll receive before your operation. The length of stay after surgery is generally from 4 to 7 days. As you get closer to discharge, you may start wondering what happens next. Once you go home, you'll continue on oral pain medications, but you're going to be generally exhausted. You're going to need help with things such as cooking meals or picking up a lot of things that might fall on the ground. So we recommend for your safety that you have a family member or friend stay with you for the first week or 2 after surgery. Once you get home, walking will be your main activity. We recommend that you try to walk a little more every day or 2 and just increase it as you can tolerate. We definitely would like you to refrain from pushing, pulling, lifting more than 10 pounds, and driving until you see us at your post-op appointment. Most of all, we want you to know that your care doesn't end when you leave the hospital. Our surgical team is here on staff 24 hours a day to answer any questions or concerns that you have. I always like to tell my patients to call us before and a question becomes an emergency. So please pick up the phone. We're here to answer your call 24 hours a day. Finally, a month after your discharge, you'll return to our office for your post-operative follow-up appointment. From there, we'll start releasing you to drive, increase your activity, and increase your lifting. We also will return you to the care of your cardiologist. We recommend at that time starting cardiac rehab. We look forward to giving you the very best care throughout your entire experience here at Piedmont.